Welcome to another episode of the Being Human and Doing Psychotherapy podcast, where I'm trying to parse out what are those human things that are behind the roles of the psychotherapist, and what are the psychotherapeutic parts which we are all carrying in ourselves. And tonight I am joined by Steve Shapiro, which I'm really happy to call my teacher for 2 months now, but still. And I'm really happy to have you here because from the little I have observed you or like witnessed your work, what I really enjoy is the combination between groundedness, compassion, and ability to hold clients. And yet challenge them effectively. And this is a very artful way to do psychotherapy, and I really respect that. So I'm very curious to hear your journey and how you came to polish that art. And so welcome, and I would start with the question, what are some words that you describe yourself with?
Well, first, thanks for having me. Appreciate your interest, and it's been nice getting to know you. So just some random words. I would say curious, interested, compassionate, practical, simple, in terms of not being too overrun by theory and complexity in a theoretical way, trying to boil things down to their essence in terms of what is easy to understand and apply, playful, try to be integrative, I've seen just so much damage from people being in different camps and loyal to certain ideas. So it's been a pleasure learning from different people and trying to connect different kinds of groups, and training people and helping them do it in a way that's fun, even though it sounds practically impossible, but that it doesn't have to be a torturous kind of journey to get trained, but it is difficult.
Yeah. It's pain is inevitable, suffering is optional kind of thing.
Yes.
Yeah. I have several avenues, but the word that stayed with me is simplicity, or trying to do things in a simple way, and it is something I feel I am learning from you as I'm going through the webinars, and I am wondering, in my mind, we often go from the simple naivete through a lot of complexity in order to boil down to the simple, to the really true simplicity. And so I'm wondering, what was that journey like for you to be able to see it as actually it was that simple kind of thing?
Yeah, you're absolutely right. In my experience, that you have to really understand something to make it simple or simpler. And I think there's a quote, something about an artist makes complicated things simple, and sorry, because you're a scientist, but a scientist makes simple things complicated, or something like that. So I just had such trouble understanding the complexity of psychotherapy, particularly in the model that I've been studying, which is psychoanalytic and short-term and focused and active and engaged and very complex as far as the organizing map. So I just always, I think it's just my nature, was inclined to ask, what's the basic principle here? I didn't want to be told what to do. I wanted to understand what's the principle. And then I felt like it was a deeper type of understanding that I could carry with me and apply And that's the same way I try to teach, as opposed to being more on the surface and focusing on what to do. And I think that approach also makes room for people's individuality. Here's the principle, here's the theory, but it could be applied in many different ways. So trying to be practical. So I try to use visual metaphors and mnemonics and have little sayings that are also that helps things be more generic and as trans theoretical as possible, so that it can apply. Here's like the basic principle that can apply as widely as possible. And of course, there's always exceptions, but that's what I've had to do for myself to understand things. And so that's what I've tried to do in training others.
And I'm wondering, so just for people, maybe we can say, what is your modality that you've been trained in? And also, did you study with psychology and then went into psychotherapy? What was your developmental journey in that sense?
Yes. So my background is in psychodynamic psychotherapy. Then I was exposed to ISTDP, intensive short-term dynamic psychotherapy, which is Dr. Habib Davanlou's model. Then exposed to AEDP, accelerated experiential dynamic psychotherapy. And for people who aren't therapists, it sounds odd to have all these complicated names, but they're different systems. I also worked in an emergency psychiatric hospital for 16 years with mostly people that were involuntarily committed. So then folding in crisis intervention and then various things along the way. So that, everyone has a different kind of combination of factors, including your personal self. Everyone is a little bit different.
And I'm curious about the crisis intervention work, because it feels like something that really helps being a robust therapist. And I'm wondering what supported you in doing that work. And also maybe as a follow-up question, what did you learn about how we see psychopathology by being exposed to basically the end of the spectrum, if you want?
Right, right. Yes. I mean, I would say that is the most extreme and severe kind of pathology, when you're seeing people act out, being brought in by police, things like aggression and suicide and deliberate self-injury and substance abuse and psychosis, just being overwhelmed and having a certain element of disintegrating. And I mean, it was an unbelievable training, and I continue to learn in whatever setting I am in. But that was just so raw and in the trenches. And people would ask me, well, how did you do that for 16 years? And, in some ways it was easier, because I would joke and say, well, when Mr. Smith is chasing Mrs. Smith with an axe, we kind of think, well, there might be some marital conflict. Things were just right out in the open. So it was just so severe that it was just amazing learning. And it was so diverse. It wasn't an eating disorders clinic. It wasn't substance abuse. It was literally an emergency facility for anything psychiatric or behavioral or emotional. So it was really the first job I had after being licensed. So I learned, it was like on the job training. And I loved it being like out in the trenches. It was really people that were in the most need, that often didn't get great treatment. And it's just a pleasure to work with them at the worst point, where
Mm,
you felt like you could have the most impact
mm,
because they were in crisis. So it's as if things were disorganized, and often people then were ready to make a change.
mm. And what did it teach you about human suffering? And also, you just mentioned the word change and our capacity to change.
People are suffering, I would say, as a result of their trauma.
Mm,
So whatever they learned, they're just doing their best, and I could see that over and over, and became less and less judgmental, because it's one thing to say you're not judging, but to really feel it and mean it and see, from my own personal journey, and that applying to others, seeing people are really doing the best that they can, but they have defensive and protective things in the way that cause a tremendous amount of suffering and dysfunction. And that's where the balance of being supportive, but also challenging comes, because that's often the kindest thing you can do, is to challenge someone, because what they're doing is hurting themselves,
mm,
and to intervene in a direct and clear and active and focused way. But that's difficult because it's not natural. You
mm.
wouldn't do that with your friends, just like, if you were a surgeon, you wouldn't cut your friends. And
Yeah.
you have to have, so we talk about training therapists as like, we have special permission to address things in a very different way that's really not natural. uh, because if someone's attacking you, the natural thing is to defend yourself, or someone says they don't want help, the natural thing is to say okay. But it's a different kind of role that we're in, if we've been given permission that it's consensual and collaborative.
Mm. And it's almost, when we speak about therapy, is almost building a new intuition that is not close to the intuition, or maybe even sometimes opposing to the intuition we have if we weren't trained to do this work, by the sounds of what you're saying.
Right.
And I'm wondering what attracted you in the first place, to become a psychologist, psychotherapist.
I was always interested. I was always interested in people. It seemed meaningful. I would just say I never really thought of doing anything else. So I consider myself very fortunate, because I know so many people that it's not clear, and they struggle. It just seemed natural, interesting, important, meaningful to help people. And I think that's what I love about the hospital, that not only was this helping people, but helping people that needed the most help at the worst time in their lives. And I'm sure it's partly personal, that things that I went through in my childhood and my family, I just became interested in family dynamics and individual dynamics, and all of that. And it just seemed like there's so much potential there to help
Mm.
people, that what a shame not to. And then when you work with people and you see them change, it's uh, it's sad that it's not a more common kind of path
Mm.
for people.
I have a smile because it feels like you're saying my words.
Ah,
It's something that after I've been in therapy or thinking about therapy for a long time,
mm,
but only when I had my personal journey and
mm,
transformation and therapeutic journey, I actually had exactly the words you said. It feels really sad that this is not available to more people and they don't know about the value of this. And I'm wondering, um how do you words what is the value of what we are doing, because I am still struggling to fully mentalize it. I have it so experientially that I have a deep conviction,
Right.
but then when someone asks me what do you really do, and I have this like big experiential step by step, day by day, therapy session by therapy session, which is always different depending on how you are, I find it difficult to boil it into this is why it works.
Right. When it works, doesn't.
Yeah, when it works.
Well, first, I would say that without a doubt, my own personal therapy or therapies were my best training because, as you're saying, I have a feel for it. I know what it's like to go through that process. So I think it's a little different for everyone, but I think, there's the idea that you come to therapy to change, but then there's also this idea that you come to therapy to be yourself and
Mm.
not change. In other words, to get the barriers out of the way that are blocking you from being yourself. So it depends how you think of it. And, in one way, you would think of it as helping people remove these barriers that they've developed to protect themselves, helping them be themselves, be authentic, not be in conflict, to be able to use what comes naturally, gifts and tendencies, preferences as readily as possible, to be as conflict free as possible, um, to be creative and loving and connected and um, productive and all of that. I mean, it would be different for different
Mm.
people.
Mm.
But I think if you're doing internal work, psychotherapy, then I would talk about that in those terms, the very internal terms, not external accomplishments. Because I think
Mm.
if you believe in human potential, um, it's it's like homeopathic medicine. It's to say we're not doing we're just kind of facilitating a natural process that went badly because of usually some degree of trauma, and then whatever was natural became, let's say, defense dominated or infused with anxiety, etc. And it's helping someone unpack that. And sometimes we talk about missing pieces, accepting back missing pieces. Think about the person that says, I'll never be angry again, or I'll never connect with anyone again. It's too risky. Uh, it's too vulnerable. And that door closed, let's say, a long time ago. And then helping people reintegrate these missing pieces, these things that have been, we call defensively excluded.
Mm. Yeah, exiled is the word I like.
Mm-hmm.
Yeah,
Mm-hmm. Right.
yeah,
Yeah,
yeah.
that's a powerful word. Yeah.
And I'm wondering, because I wasn't aware of AEDP and all the all the other short words, and it really feels it's not at the moment is not mainstream. But
Mm-mm.
I'm learning a lot about it, and it's really interesting, and it feels really powerful at times. So I'm maybe if you could give us a flavor of what they are, what is it that is unique about these approaches, and because they're short term, or at least accelerated, they're words which say you can do something in a shorter time.
Right.
What is it do you think is enabling that, which is part of the theory of these approaches?
I would say the approach I'm most identified with at this point is ISTDP, intensive short-term dynamic psychotherapy, and basically has is an psychoanalytic framework. So we look at defenses that get in people's way. We look at unconscious things, which sounds mysterious, but it's just to say things we do that we're not aware of or why we do it, etc. We look very much at what's happening in the room with the therapist. So those are some parameters that would have it qualify as psychodynamic. But unlike a traditional psychodynamic approach, which is more about insight, understanding things, Dr. Davenlu came along and introduced procedures that were not about insight. Being focused, being active, being challenging, addressing things the moment they occur, where some other types of schools would say, well, you have to wait to develop rapport. Whereas in this approach, well, this is how you develop rapport, by addressing the elephant in the room, by being in a compassionate way, but addressing, it might be in the very beginning of therapy to say, you notice how you're disconnecting. Or do you notice how you're talking about something painful, but you're smiling on top of it? Is just to be it's just examples of being active and focused and not waiting weeks or months or years. It's just creating a culture of real openness, honesty, exploration, and help people see what they're doing so they can have a choice. It's like holding up a mirror. So those are some of the ways that we try to be more efficient in the approach, by working right in the here and now. So instead of talking about something, you're looking at it right as it's occurring in the moment, in the relationship. And then you may apply that to their life. Say, so is this what happens with your wife? Do you notice you're disconnecting? And so it's very live and in the here and now, and not as insight. Insight is important to understand things, but they're all considered experiential approaches, meaning in the body, and we know that trauma is stored in the body. So we're helping to affect change in that way, not just by understanding, but by having a different experience.
And how does then the approach look at because it sounds very relational. So how does then the approach look at the transferential model, and how does it include the personhood of the therapist?
Can you say more about that?
So in Gestalt we talk about relational, we talk about co-creation rather than, or co-transference, rather than transference only. And so I wonder how do you include yourself in the process of this exchange, without using the transfers to kind of position something within the person you're working with, but rather in the relationship or in the between.
Right, because these things are co-created. I was in my monthly newsletter, I was writing a blog and say there is no such thing as a resistant patient, but resistance is something that's co-created. Because if I see you as resistant and treat you as resistant or only resistant, it probably will co-create that. So yes, I think it's important to be real, to be what I call conversational, to be vulnerable. And the way I've been training people is to say, how can we be emotionally engaged, involved, connected, all of that, active, focused, and also stay out of the way? Seems like, not to be intrusive or have our own agenda. And it seems almost like an impossible conundrum.
Yeah.
It's more to say we can be all of those things if we're involved in the process and not the content and not the outcome. So I can be very active, emotionally engaged, focused, and say, do you notice you're doing this? And do you notice you're saying this, but you're doing that? And you said your goal was this, but yet you're this. Are you curious about that? So we can be very active, involved, connected, and all of that. And I think of it as a division of labor, just a natural division of labor. The patient's job is to talk about whatever they're thinking, feeling, wanting, preferences. And then my job is to follow the process and engage with that, which means having an internal focus and a facilitating kind of role, and that you could be very active. And then you mentioned transference. So sometimes we're looking at things, how someone's relating to us in a way that is reflective of transference. In other words, it's not really about us. And then we help them. Who are you relating to right now? That you have to be so defensive or so hostile or so withdrawn. So I was just doing a training group before we met, and I gave the following example. I said, if you're 30 minutes late and the person is angry, that's more likely to be the real relationship. If you're 30 seconds late and the person is enraged, that's probably transference, right? It doesn't, you say, well, what nerve are we touching here? So that's an example. You would look at that in the here and now. You accept anything that comes up. Say, yeah, for some reason you are enraged right now, and I was 30 seconds late. Just intuitively, we would think that that's something like a ghost from the past, right? Not so much reflective of the current reality. So that's just an example, and I think it's an art is to be both, be your real self, be authentic, and that's something that I really AEDP, accelerated experiential dynamic psychotherapy, and Diana Foch in particular helped me with, to encourage me to use my playful side, my sense of humor, creativity, because I was by nature and by my training more of kind of a neutral psychoanalytic kind of abstinent neutral kind of stance. And I found it's much more effective when we're authentic and using ourselves in a measured way, in a deliberate way, not a way that's meeting my personal needs, but toward the goal of helping the person reach their goals.
And I don't know why, as you were talking, something came for me from my training, which was a question: is how do we hold hope in hopeless places? And I was wondering, what gives you the hope when you're sitting in front of another who is suffering? And you had many instances of seeing what I imagine to be places where it feels quite hopeless and inescapable.
I think it's the view and my experience seeing people change, but also the view that what is really getting in the way is internal. Yes, we all have life circumstances, and some of us are more privileged than others, and et cetera. But I've seen people that there's no correlation between emotional health and privilege, let's say, or these things are external. And yes, they help reduce your stress if you're privileged. But we all know people that are very privileged that are very emotionally unhealthy, and vice versa. So I think the view that really, when you can see or you have a hypothesis of what is causing someone's suffering, and you have confidence in a collaborative alliance that can unravel that, and it's not just theoretical, because you've seen it. I've seen it in my own therapy, and then I've seen it where I've had the privilege of participating as the therapist. People that are, dissociated and paranoid, and then are not. And there's a method to the madness. There's a method to unpacking that And it's very difficult to learn these systems. You learn that psychotherapy is more than just being a supportive, compassionate person, but it's exactly what you said in the beginning about the combination of precision and science and systems and really having tools, but being human and compassionate and relational at the same time. So, um, it helps if you really believe it, if you see that, and you
Mm.
sort of carry the hope when someone's hopeless. Just like if someone gets anxious and dysregulated, you carry the reality and the clarity of thinking because you're a team. So, but not in a way that's general, like things aren't that bad, but in a way that's specific. If we work hard, if we address these things, are you interested to see what's possible here
Mm.
specifically?
Mm. Yeah,
It's,
I think for me a lot of things have changed when I felt it was possible for me.
mm-hmm,
And then there is this internal belief that it therefore it might be possible for many others, and seeing also my therapy group peers and just the incredible strides that people make. um it's really something that at least for me fortifies me in the belief that
mm-hmm.
you called it human potential, but that we have a potential to change. And I also
If you've experienced that, you're saying you've experienced that, so then it's not just a intellectual idea, right? It's you have that embedded in you, right? That you believe that, right?
yeah,
Experienced it, right? Right.
yeah. And I think that's probably also what happens for the people we work with. Like there are small experiences that
Right.
accumulate to a knowing rather than unknowing
Mm-hmm.
in our heads. And I had a question 3 minutes ago. I was take a moment to just yes, internal conflict. So that is something that the way I came to you was through the article of Alicia Munoz. I think if
Mm-hmm.
I'm
Mm-hmm.
correct.
Yes.
And it was a wonderful article of Are You a Conflict Avoidant Therapist? And just this syntax making the sentence making the conflict intrapsychic.
Right.
And this is something that really attracted me, and I would like to hear more from you. Is how do we work with conflict and most of it, and bring it even in, actually, to backtrack a little bit, even in relationships which are not therapeutic relationships, a lot of that conflict, I can see it for myself, is coming from some internal conflict.
Right.
And I very ambitiously would love to bring these kind of conversations into our relationships, that they don't stay locked in therapy rooms, that they don't stay locked in expert conversations, but that we can really bring the flavor of how our psyches work, so that by knowing how they work we can relate better to each other. So I wonder, how would you speak to that, and maybe how can people um how can bring more of it into their relationships?
Mm-hmm. So I think you're touching on something fundamental and timely with everything that's going on in the world and probably always has gone on in the world, but the difference between tolerating internal conflict versus having external
Yeah.
conflict, because having internal conflict is very painful. So it's very tempting to take one side and really solidify it and outsource the other side. And, I've had patients say to me, well, then I can solve this conflict just by leaving therapy. Like I'm right and you're wrong, and I can solve. But if it's within me, I can't leave that. That's why people use drugs or something. They say, I can't leave physically, so I have to get away from this because this internal conflict creates anxiety and distress and guilt and shame and all kinds of things. And actually, it's a sign of emotional health to be able to tolerate complex internal conflict, right? I call it like surf and turf. You have both versus surf or turf. And if you watch the news, you see it all the time where
Oh
people that
yeah.
it's all this and it's simple. It's a bad kind of simplicity in that sense. And, and it's always convenient to have a scapegoat and it's easily solvable and etc. So we see this all the time in therapy that if we're getting close to internal conflict that's painful, it's very tempting to then create an interpersonal conflict. And it's something that people generally don't do on purpose, consciously. I was just showing a video of a woman who's saying, I'm so tempted to start a fight with you because this is getting really uncomfortable. So I have these diagrams where it's like a circle split down the middle, positive and negative. That's my internal conflict. But it's very tempting to have one circle with a plus and one circle with a negative, and I'm the plus and you're the minus, or vice versa. And now we have interpersonal conflict.
Mm.
So part of the idea is to help people tolerate their internal conflict. And I think you're absolutely right about regular relationships outside of a therapeutic setting. That I know for myself, as I'm more and more tolerant of people's conflicts, I don't need to convince them that I'm right and they're wrong, or when you just accept that complexity, or people aren't always going to please us or do and say things that we like, and then we can tolerate that complexity. I can be annoyed with something you just did and still stay connected and generally have a positive sense of you. uh, that's emotional maturity, but
Mm.
it's hard. So I think when people
Yeah.
get black and white and outsource things, uh, it creates a lot of conflict, which
Mm.
is sad and unnecessary, but very human.
Yeah. I mean, as you just said that it probably was my biggest learning and still is. The last sentence you say, I can be angry at you and still stay in contact. Because what felt for most of my growing up that anger leads to loss of contact. And therefore it felt difficult either to feel anger and be angry, or to stay in a high conflict situation.
Right.
And so I'm wondering, um, so for me now it is clear how that can happen, but maybe you can say something more for people who are listening. What does it mean to stay in contact with our anger, express it? So you actually said something interesting in I think you did said this, something about not acting in or acting out, but staying with. Maybe those are not your words, but so 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 for a lot of emotions, it feels sometimes we don't really know what a healthy expression is. And what you just described seems as a very important thing to underline. So I would like to hear more about that.
So one, specificity. It really helps to be specific, meaning it's not so much I hate you or I'm angry at you, but I'm angry at the thing you just did or said.
Hmm.
And that way it makes it a lot more palatable and not so big. I used to have patients ask me that were very perceptive, and they'd say, "But you look like you're getting frustrated," and I would deny it. But
Hmm.
and everyone knew it. I knew it. They knew it at some level, and so we're trying to ask people to be authentic, and I'm not being authentic. Versus now, I would be specific. I would say, yes, I am getting frustrated at these barriers that you're putting up because they're getting in the way of me helping you and you reaching your goals. And when you do that, people can respond, they can actually join with you and say, well, I'm also getting frustrated with the barriers that I'm putting up. Okay. So now it's you and I united against these barriers, not you and I polarized. Uh, so the specificity is important to really look at things in detail and to be human about it. The other thing important about what you're saying is the difference between experience and expression. So we'd say experience is mandatory, expression is optional. So it's always important to know what we're feeling, what we're thinking, what our preference is, and all that. But I might or might not express it to you. And that's really freeing for people because if they merge them, it's like, well, if I let myself feel this, then I have to do X, Y, and Z with it. If I let myself know that I'm dissatisfied at my job, I have to quit or I have to get a divorce. If I'm wondering about that, might be ultimately, but to help people separate and just sit with the experience without any pressure of any kind of expression. And then when you get clear about it, it's often, it gets back to that internal focus. If I'm not conflicted, if I'm clear about what I'm feeling, if I don't have defenses in the way or anxiety, and I can get clear, then I can follow what we call the action potential of the feeling, which will help guide me like an internal GPS system, guide me about what I want to do. What is that feeling telling me?
Mm-hmm. What were your barriers to getting there? What was it that challenged you the most on your journey?
In terms of being a therapist or
Well, like the human bit, like in terms of being a good partner, being a good friend, or
Mhm. How long do you have?
how
I
long
mean,
do you have? I have a free evening.
yeah, I mean, being judgmental, being perfectionistic, having ideas about how things had to go, controlling things. Like I was referring to earlier, saying, oh, this is a problem because someone has a different idea, and almost like I have to convince them. Now, I think everything's a double-edged sword. That also helped me be focused and persistent to have that, kind of persistence, but, too much is too much. And then there's rigidity and inability to see another point of view. So I've learned a lot. I've learned to really kind of let go, when to disengage. And that's been especially helpful as a therapist, is to say, not have too much investment in the outcome or agenda. That's really helped me stay present in the moment, to say we're right here, and that's not really my that's not really my responsibility, is what someone ultimately does with this, or how they use it, but to kind of give yourself in the spirit of therapy without strings attached. And I think when people feel that, ironically, it helps them change faster because you don't get into that polarized reciprocal kind of position. You actually help them, goes back to the conflict, you actually help them be in conflict.
Mm.
Uh, but it's one thing to say that, it's hard to do, to say, I'm going to really step back and not, it's like being a good parent, uh, which I also learned a lot and would love to redo that. But being a parent, but it's like saying, yeah, it gets back to being a facilitator, being in the process, but staying out of the content, right? By helping someone unpack all that, but not being overly involved in what they ultimately decide or how they do it. And actually to use that as information. If you get, let's say, a lot of resistance, to accept it and help them look at it, and then in a way, nothing becomes a barrier. It's just it's just more information.
Yeah. And I wonder, you mentioned the word rigidity. What helped you soften? And how difficult was it for you to access that softness, as opposed, I mean, for me the polarities, that's the polarity. It might not be the polarity for you, but
Yeah, I mean, it's very difficult and continues to be and is a work in progress, just to be get in touch with what you feel, who you are, what you want, try to see barriers that come up, trying to be authentic. I mean, I think it will definitely be a lifelong struggle, accepting, being less perfectionistic, all of that.
mm,
I've had a lot of good therapy over the years. I've had a lot of good supervision and consultation with different mentors. Uh, I've learned a lot, and what I've learned as a therapist has helped me as a person, and vice versa, because how can you separate it? You know,
mm,
unlike a carpenter or a surgeon, as the expression goes, we are the tool.
mm,
So, as I said earlier, when I learned to be more myself, not only did I find therapy much more rewarding, but much more effective. Because there's things that we communicate that people know that we can't, they're not in words necessarily.
yeah,
They
yeah.
they get a sense of it.
Are there moments from your personal therapy or even supervision that you remember as, and you're willing to share as something that really moved you, and that you hold as moments of deep being deeply touched and being somehow transformed by the experience?
I mean, there's so many. Would think of things. Like, let's say someone would confront me. A therapist would help me see uh, how invested I am in something, and to say, well, why would you have to argue about that? Uh, why not just let the person be, let's say, wrong,
Mm,
right? And or you know, why would you have to make an issue out of this, or why would you even have to respond to this?
mm, yeah.
At the time, that was an absolutely new idea. It's embarrassing to think back, but it never even occurred to me that that was an option, to not respond.
Mm,
Um, and that's probably why I worked well in the emergency setting with conflict, because it was like I was fairly comfortable with that. Like, we all have our strengths and weaknesses,
yeah.
but I was not very good at disengaging and accepting. So when someone said to me something like, well, why would you even respond to that? It's like a light going. I was like, wow,
Mm,
that's actually an option. I don't have to fix it, right? I don't have to make it better, because I have the like typical therapist personality. It's my job to make it better and fix it and address it, versus just shrug my shoulders and say, ah, well, that seems kind of self-defeating, but it's not my problem.
mm.
And that's liberating.
Yeah. And
Yeah.
so you mentioned that you would like to do your parenting role once more, or try to repeat. What is it that you think that taught you, about yourself, and how that made you maybe better in therapy? And what, maybe also what from that journey helped you soften towards your own parent, and how you see
Yeah.
that?
Right. Right. I heard once that you've reached adulthood when you realize that your parents are human and they have flaws and limits. And, it's not when you get married or when you buy your first house or get your first job, but it's when you really realize that your parents are flawed human beings and they're just people. So I think understanding that complexity, forgiving my parents for all their mistakes and things, even to the extent that made it difficult for me in parenting because of what I was exposed to or not exposed to. So it goes back to what we were saying before, that this complexity, everyone's doing the best that they can. No one's doing whatever they're doing on purpose. And you could say, looking at this in a more compassionate way, but I would say not just arbitrarily compassionate, in a more realistic way. That's just reality, right? That's just reality. That you look at what someone did, and it's complicated, and why did they do it, and how much did they do it knowingly, etc., and that it's just complex. Um, and it's very tempting to make things overly simplistic when it comes to human behavior. And again, you see that all the time on the news, partly because there's just not time to unpack things. It also makes us feel better, I think, to have it be overly simplistic and
Yeah.
sound bites, and this is the answer.
Yeah.
Right.
I don't know if you know the book Soul Codes, but I'm just reading it now, and there is in the introduction he says it's not that we react to how our childhoods were, it's we react to a lot of the time the memories of our childhoods, or how
Mm-hmm.
we constructed our childhoods.
Mm-hmm.
And I got to know that the work of therapy is also reconstructing, or like almost like pruning the roots,
Mm-hmm.
trying to understand what are those beliefs that even our tiny bodies made in that sense, but also the capacities we had as children,
Right.
not only the capacities our parents had at those moments.
Right.
And I don't know what's your view on this.
Yes, very similar. That our memories are probably not accurate, but we all carry certain maps with us, and a lot of them are distorted, and they may be distorted because our memories are distorted, but they may be distorted because, yes, they were accurate growing up, but now do they apply?
Mm,
We talk about people having character defenses to say, yes, now I treat everyone like they can't be trusted. Or just as bad, I treat everyone like they can be trusted. But whatever maps we have, and yes, part of therapy is emotional, part of it is cognitive, and there's a term, rewriting your narrative, understanding things differently, to say, oh, yes, now I understand why I was always anxious around people, or withdrawn, or aggressive, is really to understand that. And there's an expression that says, insight does not create healing, but healing creates insight. So seeing things differently, and emotional health would be seeing things more realistically, more complex, less distorted. And, then you're in better contact with reality, your own internal reality, which will guide you, and external reality. So neurotic people distort things some, people at a kind of borderline level distort things more, and people at a psychotic level distort things even more.
mm,
So that's what the defenses do, right? They protect us, but they also distort things.
mm,
So what you're
mm.
talking about, these memories, yes, they're distorted, and then those are things we try to correct. Like we talk about people having internal emotional schema. Everything that goes bad is my fault, for instance. And a
Yeah,
lot of times it's not
I
even
can
conscious.
relate to that one.
Yeah, me too, unfortunately. But so helping make it conscious. So
Yeah.
it goes back to this fork in the road, and this internal conflict you were referencing is then, okay, now I have more of a choice, because, oh, I wasn't really aware that I was doing that to myself, because it was so automatic. And I think Einstein said, fish are the last to discover water.
Yeah, I
So
like
it's
that.
like I've been swimming in this I didn't really realize I was doing it. But once I realized, oh yeah, I'm causing my own suffering, now I can be empowered to start to change that. So, there's lots of steps. in the process.
And I know the answer, but I wonder why is it so difficult to actually get? So that's, for me at least, it seems like it has to go through that process, but it's the awareness of, it's almost the most liberating and the most terrifying thing to get to know, to get the awareness of, oh, this was inside of me. Oh, this, I have the choice to now do something differently. And somehow the discovery, as I said, feels liberating and terrifying at the same time. And I may be more interested in, what do you think terrifies us when we see
Yeah.
things?
I'll start to answer that with a quote. I had a patient say, "Sorry to treat you like the enemy, but you're a threat to the only me I've ever known." So, you know, people resist the very change that they're asking you to help them make, because the defenses and protections and barriers have costs and consequences, but they also protect us. So it's like saying, give me your crutch. Give me the crutch that you've been using for 20, 30, 40, 50, 60 years. And let's see if you can walk without this crutch. So theoretically, that sounds good, but it's like saying, wait, I've had this crutch for a long time. I mean, I think there's lots of elements to it. And another one is what I call contrast feelings. So let's say you let yourself be different, and you let yourself be different with me. There's going to be a big contrast with the past, right? Let's say you really let yourself take that leap and experiment with doing things differently. Well, you may have rage and grief about all the years it wasn't like that, or the way you grew up, or in other words, it will bring pain. When we start to do things differently, it will be pain. And there's some song lyrics, I don't remember exactly who says, never moving forward, so there'll never be a past. It'll just be the same, right? So if you move forward and change, now the present is different than the past, and isn't that's liberating but also painful. I was saying to this training group, I think it's why the car dealership gives you a brand new car as a loaner when they're fixing your old car, because you get back in the old car and you didn't know how old it was until they gave you, you have a contrast. So they want to induce that in you to say, oh yeah, do you want this new shiny new car, not the old car. But you didn't really know there was a contrast until you got in the new car.
Yeah, that's what you're saying is actually really interesting. I love the work of Matt Lizzata, and he speaks about, bottom line, every therapy becomes grief therapy. And I feel it's often our relationship to death and dying and being in contact to that which facilitates therapy. And if there are lots of losses and compound grief,
Right.
even loss of our known personhood can elicit the memories of other losses, and therefore it's very difficult to hold. So I think eventually, for me at least, what I'm learning and learned is the capacity to sit with loss and allowing it to go through us is also helping the capacity for change, which is a very paradoxical thing, but I feel more susceptible to change the better I learn to grieve, if it makes sense.
Right. Because when, like they say, one door opens, another one closes, all that kind of thinking if I really let myself change, and I don't think this is, I mean, I never learned this formally. It just through experience that I would see, wow, this seems to be a big barrier to change because I really let myself change. If I let myself get close to my therapist in a way that I wasn't with my parents, et cetera, that's going to be very painful. Like someone says, well, I'm paying for this, but this is what I deserved growing up.
Yeah.
It's very painful. And then the doors open to start to look at those feelings and disappointments. And really often one of the first affective breakthroughs in therapy is very often grief about not so much childhood, but about the defenses that developed
Yeah.
and that what I've been doing to myself. So we help people see their defenses, their barriers, and often that's one of the first really meaningful breakthroughs is to have real legitimate grief
Yeah.
about how these mechanisms have protected us, but also hurt us. And
Yeah.
it's a necessary step to saying relinquishing them,
Yeah. I'm
giving them up.
sitting as you're talking about that, I'm sitting with those moments where you see it, it's almost like I hated that part the most, but it's that moment where you've seen the old and you know it's not serving you anymore, but you don't really know what the new thing is. And it's such a difficult space to hold and to be in that transition. And I can understand why it's so easy to collapse back, because you're like, but this is, I know this, it's easy, I don't have any certainty that this new thing will be better for me, different, I don't know, I don't have the words. And I'm just like, as I'm saying this, I'm just remembering like the difficulty of knowing there is no way back. Now I know all of these things, but not seeing the way forward. And it's a very delicate space for a therapist to hold, I think.
I think you're articulating that beautifully, because we talk about that being the beginning of an intrapsychic crisis, where it's like saying, I can see what I'm doing is not working and is causing me a lot of suffering, but I have no idea what to do instead.
Hmm.
And one analogy is like, in the circus with the trapezes, it's like it's like I've let go of the old one. I don't have a handle on the new one yet. I'm literally in midair and it's terrifying.
Yeah.
And I think that's actually another place that we don't talk about much where people leave therapy, not because they're not getting better, but because they are. They're starting to see. And it's like a panic, as you said, I'm going to panic and turn around and grab the old bar twice as hard
Yeah.
because it takes a certain faith or openness or trust to uh, be patient and see what we can develop instead. But that's a very difficult period. And that gets back to the conflict is helping people. Yes, this is what you've been doing, or these are the mechanisms and habits that are hurting you. And we don't talk about it usually in therapy this way. Do you want to practice? Because we think once you get the insight, everything's going to shift. No, no. It's like I always say, you could read 3 books about tennis. You'd be very knowledgeable about tennis, but you probably wouldn't be much better as a player. So this idea of helping people practice what we call the healthy alternative. So there you have this fork in the road between, let's say, the defensive kind of pattern that causes suffering and the healthy alternative uh, that will help the person reach their goals. But for all the reasons we've been talking about, there's resistance to that.
Hmm. And I'm curious about that fork in the road. And I always felt when I was doing therapy, and my the therapist that I felt really changed my life or helped me change my life. Um, what she was doing beautifully is she was actually, someone told me, like, you use the trapeze or lianas or whatever, like, it's, you're not you're not letting this go until you have a grasp of the other one. And it's almost, and then you feel ready to kind of slowly let it go. And I felt it was a very slow melting. But I'm wondering, when you work with clients, what, how much you're, how do you give the healthy alternatives? Are you aware what healthy alternatives are? How do you think about the healthy alternatives in general? What does that mean for you?
Right. I mean, it's really important to help people experiment with that and get a feel for it experientially. It might be a little thing, but to help someone experiment with what are their options, what is a healthy alternative, what would just feel natural and and good. And so it's a whole multi-step process, seeing how the self-destructive thing is self-destructive, seeing the costs, as you were saying before, grieving that, and then seeing what's the healthy alternative. And the way you're phrasing it makes sense to me, because I would half jokingly say to trainees, how do you stop someone from being blank? Let's say delusional, depressed, like attacking themselves or whatever. Uh, and then the answer is you don't. You don't stop them from being delusional. You don't stop them from attacking themselves. You help them develop the capacity to do something else so they no longer have to be delusional or attack themselves or whatever. So otherwise, it's like saying, you're drowning, give me your life, the only life jacket that you have, give it to me. And then tread water while you learn to swim, versus we have to help you have something healthier, maybe a boat, before you're going to give up this life jacket, because it's been keeping you alive. So it's kind of like you're pendulating back and forth between the two. Do you want to, in what I call a traffic cop, I say, here's the fork in the road, but then that goes to traffic cop. We say, so if you didn't do this, do you want to experiment with doing this? Right? If you didn't, here's your fork in the road, here's the choice. And then, so do you want to take a risk and see if you don't detach or disconnect or whatever? Do you want to see what emerges here when we connect? Or if you don't attack yourself, do you want to see about these feelings towards your boss or whatever it is? So, you can see it's just a series of steps. Someone might be in the step where the fork of the road is more appropriate or more timely, because they're not ready to do this. You say, yeah, here's your choice. But then as they start to tilt toward the healthy, you say, okay, so let's see, if you didn't do this, what do you want to see that's there? And that's where it's work.
Yeah, and I really like this as an invitation. It's almost your movement is inviting a collaboration or exploration, which is really, really nice. And I wonder, in your development, what was challenging? What was something that really kind of shook you and you felt out of your depth, and where probably most of your growth was as well?
I mean, so many. I think everything we've been talking about is, being able to see things more clearly, to have a solid map, an organizing map, without being what I call a technician, using this in the process, but staying connected, that temptation to do one or the other, to bring in your humanity at the same time, using this map. So going like this, back and forth, not being overly invested in the outcome, helping people really see their options and change. And it's like a balance between being supportive and challenging. And if your head is in a place where someone has to change, it makes it almost impossible to do that. So now in training people, I talk about highlighting and inviting. So joining and challenging. And it's hard. I mean, it's hard to learn to really say, I'm going to join you exactly where you are, which if it's self-destructive or hostile or whatever, is just to have that acceptance and then invite them to do the next thing, the task. So join and challenge both. Difficult.
It is. Yeah. I mean, that's exactly, I think, why I was curious about your training, because it was easy for me to join, less easy
Right.
to challenge.
Right.
And so it was also about, challenge is a word that I think has a bit of a negative connotation, but what I'm starting to understand is that I was challenging, but
Right.
it was a soft challenge. Seems like a head-on thing, but it doesn't have to be that, and it
Right.
can still be presence is someone sometimes challenging for people.
Right. And I think that's where that idea, the importance of not being overly invested, it's different. I can challenge you because you want me to, because it's in your best interest, but not be overly invested to know when to back off. And again, things are so difficult in the field of psychotherapy because there is nothing to see. Everything is conceptual.
Yeah.
So it's important to have a map. And to make it more clear, you say, well, if you hired a personal trainer to help you reach your fitness goals, wouldn't you want him to challenge you? Right? I mean, isn't that why you hired him? Now, you don't want him to be abusive or to be more invested in running a marathon than you or whatever. But right, if we see that not as a kind of a dirty word, is like you could say lovingly challenge someone. It's or to highlight someone's defenses. Because if we avoid doing certain things, yeah, we have to ask, is that because it will make the person uncomfortable? But is that okay? Like, just like if you're a personal trainer, people are going to breathe hard and sweat. Or is it because it's going to make me uncomfortable to address the elephant in the room? And am I willing to do that? Or am I willing to have someone be temporarily angry at me because I'm highlighting something difficult, right? So all those things that we can't separate the person of the therapist from the technique, because they both have, and that's what the research shows as well, the so-called common non-specific factors like accurate empathy and attunement and just interpersonal skills are just as important as the highly technical skills. I think when you bring them together, you can have a very powerful combination, but I've come to see over the years you really need both.
Mm, mm. And I was curious. We mostly spoke about you through the therapist role. What is surrounding you? What's your support, and what do you enjoy outside of that role?
Yes, you're talking about self-care, right?
Mm,
How that's just so important to be
yeah.
supported, to be kind of grounded, right? Yourself, and some days are better than others. But we mentioned personal therapy. I've had a lot of good supervision, friendships, my girlfriend, my kids, doing things that I love to do. I do a lot of mountain biking and woodworking and
Mm,
renovating things and things that are physical, not so mental. So working hard, playing hard, and trying to be good to yourself, having that balance is
Mm.
important.
How easy is it for you to be good to yourself?
Not easy. Uh, yeah,
I
I
got a sense.
yes. When I'm doing training groups and they say, I say, so do you want to take a 5 or 10 minute break? They say, how about a 15-minute break?
Yeah.
Or in the retreat I just did a 4-day retreat, uh, and they said we had evening activities. And I was saying, you guys want to do like case consultation, or you just want to like watch a movie or something? And someone said, hi, I'm Steve. Do you want to work after you work? Right. So yeah, but it's, I really enjoy what I do, so
Yeah.
it's very meaningful. So that makes it difficult, because it's not like that expression, do what you love and you never have to work a day in your life.
Yeah.
So, yeah, to me,
Yeah.
there's like a big overlap.
Yeah. Yeah. I mean, I can see your passion for it. So it's yeah. And I'm wondering in terms of again uh your development and how you kind of your journey and you mentioned integration. What are other therapeutic modalities that really informed you or really helped you to work better with some clients than with others? When you're integrating, what are you integrating in your specific case?
I found that psychodynamic theory gave me a rich, complicated understanding of human behavior and dynamics and defenses and transference. And one of the biggest things being that people are not logical at all. I can't tell you the number of times I say to someone, look, if this were logical, you wouldn't even be here. So let's look at this in a very different way. And I think it's the hardest thing with trainees as well, is to see that things come up. You're not going to convince someone. It's not going to be logical. So that's having that foundation is important. ISTDP has a very precise, specific map, and also a culture of being direct and addressing the elephant in the room. And then whatever emerges. So that was important. AEDP helped me be more myself, more relational, more human, and less pathology centered, to really try to see the whole person. And then there's been lots of smaller influences like memory reconsolidation and focusing, and as I said before, crisis intervention. And then whatever you just learn that you can't even place in a model, you just,
Mm.
it's somewhat learning to be intuitive, paying attention to that, where your interventions don't have to be rigid and step by step, but you're doing things that are more creative. You may tell a story, a joke, or um, different things. In fact, I'm doing a webinar with two other people in January that's about differences in experiential dynamic therapy, about how did we all have our journey, how did we all learn to have these principles, but kind of hold them back here, and
Mm.
then be ourselves, relate to the person in front of us, more being informed by the theory, uh, but more relating to the person in front of us, not the theory behind us. So using those things, and then using yourself, your person of the therapist, and that's where we're doing this. We're saying, okay, here's my organizing map, but what am I experiencing here? What does this tell me? How can I relate to this personally? I really think you need both. And I think that's why the literature shows you need to be really good with these common factors or non-specific factors. But as Roger said a long time ago, that's necessary but not sufficient. We
Yeah.
need that And then this here, I think together, it's a more complete package.
Yeah. There is a therapist I love, Bonnie Badenoch, and I really find the name of her book beautiful. It's called The Heart of Trauma. So
Mm-hmm.
I feel like it connects, it brings the holding in the analysis.
Mm-hmm. Mm-hmm.
Yeah.
Right,
Yeah.
right, right. You have to, there's an expression of the iron fist in a velvet glove,
Mm.
right? Is to have that range
Yeah.
of what to do when, and can you be firm? Can you be soft? Anyone could be one thing, but
Mm.
to have the flexibility and uh, the ability to shift
Mm.
in the moment is huge.
Mm.
So it's a difficult thing because it's having a solid organizing map, but at the same time, not like a rigid route in the map, but being able to go, if you come to a fire or a sinkhole, to be able to go around it or
Mm.
be flexible enough to alter your route. And then it's like a dance, right? It's like a dance that you're doing with someone, not so much like a boxing match, but really having that flexibility is important.
Yeah, and just something that was coming to my mind, and I'm curious because not many people recently have talked either on the podcast or in general about enactment.
Mm-hmm.
And I'm noticing as I'm re-listening to my work in my training and also observing the work in the training, I can see how when you're in the space, even though
Mm-hmm.
it's a triad, but if I'm the therapist, uh, it's it's really something that happens out of consciousness.
Right.
Um, and I wonder, um, I don't think it's even possible to be fully aware of it unless, I mean, it's only comes over and over, but it's quite an incredible process. I just don't know how it works. I see it constantly. Like I remember one session where a friend of mine, like my peers, one person said, I really hate that people tell me what to do in my work. And then the therapist said, let's do an experiment, and he set it up. And then the client, he was then able to kind of differentiate, but it only after it got enacted.
Right.
And so I'm wondering, how can one be holding this in awareness? It's where my fears lie. And
Right.
also, but my therapist, she says that we are in a way a vessel for that enactment to happen to some extent. And so,
Right.
but it's a fine line. So I'm wondering what your thoughts are on this.
Yeah, really difficult area because I would agree that we're all going to do that. And hopefully we get better and better at avoiding those enactments. Like you'd say, we want to redo this, not relive it. And that goes back to having the internal focus, helping people be in conflict, not enacting it, not taking what I call the reciprocal or polarizing role. If someone gets very helpless, and then we get very helpful rather than staying in the process and pointing out, wow, do you notice the position you're taking now?
Mm.
So I think it's an awareness that this helps with, and this helps with having a map, seeing what's happening. I think you're right. It's inevitable, but it's like an aspirational goal that
Mm.
we try to just really reflect and observe and see what's happening, and no horrible harm if we step into it, because as you said, partly that's how we see it. And I would often say to trainees, I say we want the car to make the bad noise when we bring it to the mechanic.
Mm.
So, when that happens, we try not to step into it. Sometimes we do more, sometimes we do less. But at any rate, trying to eliminate that fear that what if this happens? What if I say something and the person starts shaming themselves or attacking themselves? Well, we want the car to make the bad noise. Then we start to address that. Or if we're human and I step into those shoes, I might notice it. I might say, wow, boy, I'm not being helpful here at all. I'm acting just like your mother. I just kind of went right
Yeah.
into that. And being human, I'm reminded, a story I often tell is, I had a patient come back for a session and say, you know, I really don't think you were really very present last time. I really, you were not yourself. And luckily I remembered that was true. And I said, you're absolutely right. Because we don't want to gaslight anyone and look at
Yeah.
the joining and then challenging, highlight and invite. But to say, you're absolutely right. I remember that. I was exhausted. I was not at my best. You did not get my best. I'm sorry. You deserve better than that. And now let's look at your reactions to me. So
Yeah.
you just use it, whatever it is. The freedom, when you ask what are some things that changed for me or I learned, just to be open. As I said, I would basically just distort when someone say, "Yo, boy, you look like you're getting frustrated."
Mm.
I say, "Oh, no, no," or here, what freedom just to be able to say, "Yes, yeah, I'm human. I have a life, and for a variety of reasons, I was exhausted, and you did not get my best, and I'm sorry. And now, should we look at that?"
Yeah.
And this person's first reaction was to start crying and saying, "I can't believe you're just admitting it. I've never had a therapist just admit that." And then she didn't really want to look at it. She said, "Well, now I feel terrible." I said, "Well, who's the one that should feel terrible here?"
Yeah.
And so we talked about it. He said, "How about if I practice feeling terrible and you can practice feeling angry?" Because she was angry. She didn't, and she had every right to be angry.
Yeah.
Uh,
Hmm.
so yeah, as an example of transference and real, because it was like, real, I'm angry that I didn't get your best. And then transference, yeah, let's see what this is bringing up for you.
Yeah. Yeah. I must admit, I'm enjoying talking to you, but I'm thinking that we might have a same pattern of being able to go on and on and on about
Yes,
this.
yes, yes.
So I just want to ask you, maybe if there is something that you kind of really want to share, but I haven't asked, that you would like to add to what we have discussed.
You've been very thorough, and I appreciate that. I would say for people in training, just to be kind to yourself, because it's a difficult process, and learning these models, and because we're the tool. We don't have a carpenter kit. We don't have a surgical bag. Um, it's difficult and it's vulnerable. So I think it'll go faster by going slower, being compassionate, doing deliberate practice, taking one skill at a time, and just being realistic with
Mm,
yourself.
thank you. I think I needed to hear. It's interesting how I get messages in the podcast exactly at the time when I need them and the ones that I need.
Well, you're
Um,
receptive to it when you're
yeah.
receptive to it, right?
And one question I like to ask, because I love idiosyncrasies, is there an absurd thing about you that not many people know about? Something that would be un-Steve like, but you do it.
Gosh. Yeah, I don't know, because I don't know what people think. I don't know what their typical, what would be thinking would be atypical. So I'm drawing a blank on that.
Yeah.
Yeah, I
Mm.
can't think of
Well, I'm
anything.
wondering, you called yourself as someone who works a lot, or like, is there what's your lazy or guilty pleasure?
Oh gosh. Yeah, I can be very lazy. I love we have an RV. I love, it takes me a couple of days to get into that mode, but I love to just hang out and just play and sleep and just be on the road. It's like freedom of almost not even being somewhere, but literally on the road, of just having this cozy, self-contained thing. And I have so much complexity with.
Yeah, I just wanted to say not having structure as opposing to having a very structured, routine, and organized.
Right, because I love that, because I feel like, trying to keep so many balls up in the air and doing things, and then having that, the best is like, even we don't even know where we're going. You just start. How often in life can you do that? So as structured as I can be, I love being unstructured, which I think is what I like about certain things like mountain biking. It's just playing, getting dirty, flying in the air. I mean, it's just pure fun and physical. So,
And in the
yeah,
moment, yeah.
right. You can't not be in the moment when you're coming down some hill and there's rocks and roots, and yeah, right. It kind of forces you to get out of your head.
Yeah.
Right.
It was lovely to see the playful side of you coming out in this in this answer. Yeah. And lastly, is there any questions you have for me after the conversation?
Um, how was this? Yeah, what's this like for you to be being on that side, being interviewing people, and anything that surprised you?
Um, I don't think I was surprised because I felt like I've had a little bit of a sense of
Mm,
you from the webinars. Being on this side, I really like it. Feels like a big privilege, um, because I I think I interviewed now about 50 therapists, and it's just seeing how we can be so different and yet supportive and helpful, and in bringing that uniqueness, bringing the uniqueness in others. That's it feels like I'm having the privilege to build this bigger whole by having a
mm,
mosaic of different experiences, especially because different therapists um almost like they solve a small piece of the puzzle for themselves, and they integrate a small piece of traumatic experience in themselves, which makes them able to facilitate that for their clients. But
right,
different people would integrate different things.
right,
So it feels like a kaleidoscope of experiences, is one reality, but then a lot of different flavors. So it's a big privilege to be on this side, and because I love stories and holding spaces for people to tell their stories, that's another really big privilege. And I think what I was left with um was the gentleness in some of your answers, but also just thinking about how difficult it is for you to be gentle towards yourself. And that I was like, ah, it sounds very, very familiar.
mm,
And how for a lot of therapists that is often the struggle.
right. And I think that's why when you asked about it, like a final thought, the emphasis on just being kind
Yeah.
to yourself in the training process, because it's something that's difficult for me to do, and to let yourself enjoy it, not only be successful at it, but to enjoy it along the way. Um,
Yeah.
it's like a gift to yourself.
It is a gift. That's my experience of the training process. It's a wonderful gift, and every new year feels like I want to take it slower and slower.
Right.
I am like a little bit impatient to get to the point of actually working with clients and being able to do that part, but I would love to savor this process. And I think I
Very
really
wise.
think I even think, like, you know, in the old times where therapy programs were maybe 5, 6 people would making breaks and all these kind of things. I feel it's sometimes important because we are there to facilitate the organic expression. And if we in the academic setting are not allowing therapists to notice what's organic for them,
Right.
I think there is a lot of loss. But now I finally settled in. I will have my like 3 years, and then I can take it very like really savor it, because my livelihood at the moment doesn't depend on it, and I would really love to stick to that. Yeah.
Yes. And you have a lot of the fundamentals that are required, being
Mm,
intuitive and observant and direct.
mm,
And a lot of those interpersonal skills are foundational,
mm,
which I don't think, I mean, I think that will be a huge benefit for you.
mm. Thank you. I will sit with that. Thank you. Well, I really want to thank you for your time and for your knowledge and for your kindness and for everything you bring in your work. And yeah, I'm curious to continue learning from you.
Great. Yeah, I look forward to that.